Are laser treatments safe for rejuvenating skin and inducing collagen?
Lasers and other thermal treatments are used to induce collagen production for the purpose of improving your skin's appearance. Although laser technology has advanced to reduce risk of complications, the importance of knowledge and experience by higher level practitioners cannot be overstated. It's become routine for me to see patients whose skin has been overtreated by aggressive heating, resulting in their skin looking even more aged. It's generally understood that complications can happen even with a highly experienced doctor. I often see patients who chose a particular device-based treatment on the recommendation of a non-physician using a cookbook approach, only to later realize that there were specific issues that were not factored into their treatment that later turned out to be very important. I'll discuss my approach to helping patients with cosmetic skin issues in my practice, including how I combine device-based treatments with other therapies to reduce risk and optimize results. I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery and a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I've been using lasers since the first fully ablative CO2 lasers, which were introduced in the mid-90s. I have several different lasers in my practice, including fractional CO2 and fractional erbium lasers, as well as ND-YAG and Q-switch lasers. I use radiofrequency treatments like Pelave for skin types that cannot be safely treated with laser. I was an early adopter of PRP, or platelet-rich plasma, for collagen induction therapy and skin quality improvement. For the purpose of skin rejuvenation, lasers and thermal energy devices, as well as treatments like microneedling, are based on a controlled injury model to stimulate collagen production. Collagen is a critical protein that provides skin its structure and strength. New collagen production can make skin appear firmer and tighter to treat signs of aging like skin wrinkling and skin laxity. In recent years, an increasing number of devices are being presented to the general public as alternative options to surgical procedures such as facelift surgeries. These devices are designed to induce collagen production by heating the skin to a critical temperature for a specific period of time. The assumption is that the individual being treated has the capacity in their skin to produce the expected amount of collagen. In my opinion, this assumption needs to be more critically examined. Specific details in an individual's history, such as previous cosmetic medical procedures, including other laser treatments, are very important in determining the potential benefits of an additional laser type of procedure. The medical history, the current medications the patient may be on need to also be factored in to the planning of any treatment, including a cosmetic laser procedure. I also look at my patient's skin to determine if the critical issue is limited to wrinkles and skin laxity, in addition to other issues such as sun damage causing skin discolorations. I think it's important to understand that the skin has a physiology like any other important organ in the body, and that your lifestyle impacts your skin the way it impacts your heart, your lungs, your liver, etc. I often compare skin rejuvenation to resistance training for muscle building. If you work out properly, you stimulate your muscle to grow and support that growth with nutrition. If you overstress your muscle, you're at higher risk of injury. This same principle, in my opinion, applies to your skin. In the context of aging skin, where 1% of collagen is lost every year from the age of 25, my approach is to be less aggressive and combine therapies to support collagen production and minimize the risk of complications. For example, I routinely perform fractional CO2 laser procedures combined with the application of PRP, or platelet-rich plasma. A laser is being used to induce collagen production after a controlled injury. PRP also induces collagen production without an injury. I'm not saying that PRP is an alternative to laser, but in my experience, the synergy of less aggressive laser combined with PRP to enhance collagen production has worked very successfully for my patients. Now, taking it a step further, PRP can also be administered in combination with hyaluronic acid in a procedure we call skin boosting. This is where a synergistic benefit of PRP and hyaluronic acid delivered to the dermis, which is the backbone of your skin, can be very effective without inducing a significant injury. Similar to my comparison with muscle building, the benefits can be additive with subsequent sessions. As I mentioned earlier, skin discolorations often accompany collagen loss in the skin due to sun damage and aging changes. I'll often perform a procedure called laser skin toning, which is a non-ablative treatment in combination with skin boosting. In contrast to an ablative procedure, the outermost layers of skin remain intact, and so the patient has no downtime and they can come in on a regular basis without disrupting their schedule. There are a lot of new and interesting devices in the marketplace for aesthetic treatment. In my opinion, the financial incentives driven by the high cost of marketing and leasing of these devices results in overselling of these treatments to people who are not appropriate candidates. It's a very slippery slope when people looking to avoid surgery go to a medical retailer selling a procedure that's represented as an alternative to facelift surgery. Very often, a person who'd had this treatment doesn't see the results they were expecting, and the practitioner who sold them the treatment subsequently increases the amount of heat being delivered to the skin, resulting in worsening of their skin laxity and thinning of their skin. This same individual would have probably been better served non-surgically with a procedure such as structural volumizing with long-lasting hyaluronic acid fillers, such as what we do in a procedure called the Y-lift. Again, the assumption of both the patient and practitioner was that facial aging was limited to their skin, completely missing the significant impact of bone volume loss. The cliche that to the person with the hammer, everything appears to be a nail is applicable here. The take-home message is that there's more to facial aging than skin tightening, and that a comprehensive evaluation by an unbiased professional can potentially help you avoid problems like those I've discussed. Strategically combining lower risk and effective procedures can help you look your best at any age. I hope this information from my experience helped you. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.